Neonatal seizures are the most common neurological emergency in newborn infants. They are caused by sudden, abnormal electrical discharges in the baby's developing brain. Unlike adult seizures, these often stay localized in one area of the newborn brain. The leading cause is hypoxic ischemic encephalopathy, or HIE, due to oxygen deprivation. Brain infections like meningitis or sepsis can also trigger seizures. Metabolic imbalances such as low blood sugar or hypoglycemia are a frequent cause. Sometimes, structural brain abnormalities formed during pregnancy lead to electrical instability. Recognizing neonatal seizures can be challenging. The most common type is subtle seizures. These can appear as lip smacking, eye rolling, or rhythmic limb cycling. Clonic seizures are characterized by rhythmic, slow, jerking movements of a limb. These movements cannot be stopped by gentle restraint, distinguishing them from tremors. Tonic seizures involve a prolonged stiffening or rigid posturing of the limbs or trunk. Myoclonic seizures are rapid, single jerks that often involve the arms or legs. Diagnosis is confirmed through an electroencephalogram, or EEG, which records brain activity. The EEG helps identify specific seizure patterns, even if they're not visible outwardly. Bedside ultrasounds are often performed to check for brain bleeding or structural issues. A detailed MRI scan provides a precise map of the brain to locate the exact cause. If an infection is suspected, a lumbar puncture tests the cerebrospinal fluid. Immediate treatment focuses on stabilizing the baby's breathing and blood pressure. Anti-seizure medications, like phenobarbital, are usually the first line of defense. These drugs work by reducing the overactive electrical signals in the brain cells. If the first medication is ineffective, other drugs like levetiracetam may be used. The goal is not just to stop the physical seizures, but to protect the developing brain. Close monitoring of the baby's vital signs and brain activity is continuous. Most neonatal seizures resolve once the underlying cause is identified and treated. But you heard in the Nayuful. The long-term prognosis largely depends on the specific cause of the seizures. Follow-up with a pediatric neurologist is essential to monitor development. The developing brain has a remarkable capacity for recovery and adaptation. Early intervention and therapy can significantly improve developmental outcomes. Understanding neonatal seizures ensures timely intervention for the best possible start in life.